Daily bike rides with his dad have been a constant in Quincy Raven Jackson's life. But when the pandemic hit last spring, a lot of other things changed for the 19-year-old who was then in the gap year between high school and university.
It just was so boring. I had nothing to do.
Challenging for any young person, but especially so for one with an anxiety disorder.
I have difficulty with social interaction sometimes. So not seeing people, I sometimes forget that how much these people care about me and stuff like that. So it was very lonely.
The loss of connection with friends during the pandemic has taken a hard toll on the mental health of teens, and intermittent school closures have taken away many of the things that give them joy and confidence.
The extracurriculars is what really makes school school.
16-year-old Serena Sri, who is also dealing with anxiety, says she misses her dance classes the most. Online classes, she says, just didn't feel the same.
Not having that escape is tough, and losing something that I love so much and passionate about is really tough.
Of course, getting teens to talk about what they're going through is not easy, even in the best of times. So this child psychologist came up with an idea, asking kids and teens to put their feelings into artwork. The result is an online exhibit called Child Art.
Some of the words that the kids have used in their artwork is, what's the point? No one cares. This is too much. I am not okay. Broken, right? Just feeling broken.
Dr. Nikki Martin says parents can help by fostering conversation and showing their own vulnerability.
To normalize that it's okay to not be okay now.
Serena and Quincy say they're both lucky to have good relationships with their parents as they keep moving on the long road of life ahead of them, even if right now it seems like they're standing still. Sumanac-Johnson, CBC News, Toronto.
Let's bring in Dr. Nikolai White, a family physician in Toronto, and Dr. Chang, a psychiatrist and associate professor at UBC and parenting author. She joins us from Vancouver. I want to hear from both of you on this first question, and starting with Dr. Chang, if I may. What impact are you seeing in your practice on kids?
Right, Ian. So I think I'm seeing very similar to what's been called the K-shaped recovery of the pandemic. I'm seeing that in my practice and in mental health too. There is a small segment, that top arm of the K, that are actually doing better. These are kids that may have been overscheduled, sleep deprived. They're having dinner at home with their families instead of in a car being shuffled to an activity. They're talking about greater connections with their loved ones, and they're less busy. So that's one arm, but the bigger arm is that down end of the K. These are vulnerable youth who may have pre-existing mental health issues. 1 in 4 of all Canadians. Adolescent brain is the most sensitive. Kids with concussion history or trauma histories or marginalized communities, poverty already. And they are really suffering in this pandemic. We're seeing increased rates of anxiety, depression, video game addiction, increased use of screen time, which can be very negative, including upticks in cyberbullying and across the board. So we're definitely seeing both. It's not all doom and gloom, but there's a very large percentage that we have to be very concerned about.
And Dr. White, as a family physician, you kind of see this on the intake level in your practice. What are you seeing?
Yeah, so we're seeing that kids don't have the same access to extracurricular activities that they normally would. And I think, that's something we took for granted growing up, being able to participate in organized sports, music classes, and even important milestones like graduations. These things are now canceled, and we don't have a really good solution for them. As Dr. Chang alluded to, the increase in screen time isn't necessarily a fix to this problem. And so it's a matter of finding ways to get kids engaged in other extracurricular activities that often they have to do by themselves. So it is a big challenge, and it's something we're working towards solving.
And I think it underscores why we're hearing from so many public health doctors about the importance of keeping kids in school as much as possible, given COVID safety. Dr. White, I assume you're an advocate of trying to keep kids in school.
Yeah, it's important. I worry about long-term consequences of kids being at home. We don't want to see this impacting their long-term growth and development, because the longer they stay at home, the longer they're isolated, they're missing out on those key life experiences, the ability to learn how to develop relationships, how to develop social skills, how to develop self-confidence. And so it is a priority for all of us, and we're doing our best, and we're working as hard as we can to keep our kids in school. I think we have to make that a huge priority.
Well, let's talk about advice. Dr. Chang, I'll start with you.
I would tell young people that, first of all, your brain is not broken. It is unfinished. There's a lot going on, and this can be a very tough time. But we know what can work. Routine, regular sleep, exercise, outdoor, sunlight, exposure, positive social connection, play, your hobbies, recreation is recreate. So do all those things consistently. If you can't, you might need help. You might need some vitamin D or a sun lamp or a therapist or even medication, so get that help.
Dr. White?
Yeah, I have similar suggestions. I think physical activity is always important. 30 minutes a day, get outdoors, go for a walk, ride your bike. An artistic endeavor would be a recommendation as well. Being engaged, you do have a community out there and everyone is going through a similar challenge. So feel free and make sure you're reaching out to your social network to keep that intact as well.
And Dr. Chang, one very quick follow-up. Are people taking all of this seriously? Are they engaging, for example, with psychiatrists?
You know, I hope they are. And I want to just make it clear, we definitely need psychiatrists, but there's family doctors, there's school counselors, there's teachers, there's sports coaches. You know, it really is a community approach. So I'm so thankful that programs like this are talking about mental health. We really need to help this current generation to move and get into that course correction. And some are learning skills that are going to be so helpful for the rest of their lives.
And we're thankful for your guidance. Dr. Chang, Dr. White, thank you very much.
Thanks, Ian.